Hey everyone, how you doing? In today's video, let's look at guided surgery for implants. Okay, so if you're thinking about having implant treatment, what is guided surgery? If you've done a bit of research on Google, you may have come across this term and it may have confused you. It definitely confused me for a little while when it first came out. I'm going to show you when it's usually a good idea to have guided surgery and the pros, the cons, why it's worth paying a little bit more in the right situations for having guided surgery, and why every single dentist in the world does not use guided surgery. So let's first of all look at a typical situation. Okay, it's not all on four. It's just a single tooth implant. Here, this lady came to see me a little while ago. This tooth in the front has an ongoing problem. It's got recurrent infections. It's actually got crack down the middle of the tooth, and there is no treatment that we can do which will definitely get rid of this ongoing infection. So we have to remove this tooth and we have to look at then replacing the tooth with something. We could look at bridges or implants or dentures. These are all good tooth replacements, but after going through all the options, she wanted something as close to her natural tooth without adjusting the other teeth, so we decided to go with a dental implant. Now, it's at the bottom, it's at the front. These are the four smallest teeth in the mouth, which means when you take it out, you don't have a lot of space to play with. You see, the teeth either side have long, thin roots, and quite often the roots aren't perfectly parallel, they kind of taper in a little bit. And let's say for argument's sake, we've got a 5mm space, okay? And this is about typical. So we've got 5mm from root to root, and the thinnest implant that I've got is 2.8mm. So to keep the math simple, let's call it 3mm. And for argument's sake, this is pretty realistic, we want a millimeter of bone all the way around this implant. So suddenly, this 5mm of space that we've got, we need a millimeter of space on either side, so that's 2mm taken up, and then we've got the 3mm of the implant thickness. That's our full 5mm taken up. What this means is there is absolutely zero room for error. Okay, it's a lower jaw as well, so when the dentist is trying to make the hole, the lower jaw moves. So you've got a moving target, you've got a error of zero that you can do. I mean, how many times, if we were placing this implant 100 times on 100 different days, how many of those do you think would be pinpoint perfect implant positions? Okay, I don't know. I'm going to guess at maybe somewhere between 50 and 70% would be really good. Okay, that means that 30 to 50% the implant position could be improved in some way. And it's very difficult to get everything right every single time without some additional help. So that's where guided surgery comes in. So this is a surgical guide. This is what it looks like. And what it is, if you imagine this pen is the drill that we're going to use. The surgical guide has a hole in it, which is the perfect size for this drill. And this drill's got little markers to tell us the depth, which means that when the drill is placed, the hole is in exactly the right position. And therefore our implant is going to be in exactly the right position. Or so the theory goes. You see, I tried guided surgery about 4 or 5 years ago, and what I found was that it wasn't as accurate as it should have been. Now, before I tell you a little bit more about that and the recent advances, let me show you how this guide is made, because this is actually pretty interesting. See, let's say you were coming to see me and we were thinking about having dental implants, and it was a good idea to have a surgical guide made. The first thing I would get for any implant case is a 3D scan. We call it's a CT scan, a cone beam dental CT scan, and this lets me navigate all around your bone. And I can see the thickness of the bone, I can see the distance between the roots, and I can import that scan into a specialist implant software, and I can virtually place the best implant. These implant softwares have got a whole, have got all the implants pre-built into them, so I can virtually place and decide what the best length of implant is, what the best thickness of implant is, and the most ideal implant position. And this can all be done virtually just from a CT scan. But the CT scan isn't good enough to make a guide on its own. You see, what we now need is a 3D model of your teeth. And I get this in a number of ways. First of all, just with a standard dental impression, a dental mold, we can send this to the lab and get this scanned in to make what we call an STL file, which is a 3D model file of your teeth. At one of the practices I work at, we've got a pretty cool machine, and it's like a little camera on a stick, and it's a 3D scanner. So we eliminate taking molds in a lot of cases, and we just do a 3D scan of your teeth. And this is pretty cool because this can just be emailed to the guys who make the guide. Then they will take the CT scan where we've placed our implant, they will take the STL file and they'll merge them together, and from that information we can then 3D print a little plastic guide which sits on top of your teeth and has this little hole in it, and because it's sitting on teeth, there's no movement. You see, if a guide was sitting on gum, you could move it a little bit and that would introduce error. Whereas if it's sitting on teeth, you can actually be very accurate with the implant placement. Now, all the techie geeky stuff aside, does it produce excellent results? And I told you a minute ago that when I first used it, it wasn't that accurate. And the truth is, about 4 or 5 years ago when I first got into this, the technology wasn't that accurate. And the reason is, if you imagine, there's a lot of steps to actually making this guide. You have to first have an accurate scan, you have to have an accurate CT scan, and you have to have a system to merge these two things perfectly together. Now, a small error early on in the first couple of stages can then be amplified to a much larger error later on at the time of surgery, meaning that there was literally no point in having that guide made because you could have done a better job freehand. Now, I actually stopped using guided surgery after the first few attempts that I did, and it didn't work out as accurate as I wanted it. But I actually spoke with a friend of mine last year, and he introduced me to a new system. He said, hey, look, if we do it this way, we're working on reducing the error and making excellent guides. Do you want to give it a go? And I was like, okay, if it's better for my patients, if it reduces stress, yeah, I'm totally up for that. So we then worked together, and I did a couple of cases, and I was really, really impressed at how accurate and how things have, advanced recently. So nowadays, I will almost certainly, for single tooth implants or multiple teeth implants, especially anything at the front of the mouth, I will use a guided system. It's more accurate, it means my patients get better results. It does cost a little bit more to have the guide made, but I think it's just well worth it. We don't make any money on the guide. It's literally just something there to improve speed and accuracy of dental implant treatment. Now, you might be thinking, if this is such a great thing, why doesn't every implant dentist in the world use this? And the reason is multiple. Now, one reason I've told you, the reason I stopped is because I tried it and it didn't work so well. And a lot of dentists will have tried it 4 or 5 years ago and it's not been that amazing, so they will stick with what they know, which is just to do it freehand. And that's fair enough, because they are ultimately doing what they believe is the best thing for their patients. There might be another reason why some people don't, and that is the additional investment needed to actually use guided surgery rather than standard surgery. You see, for every implant system we use, we've got a set of drills. This is called our surgical kit. And the surgical kit is pretty expensive, in the UK, £1,000, £2,000, £3,000, in that kind of ballpark. If you then want to move to guided, you have to buy a new kit and you have to buy a guided kit. The guided kit costs typically 1.5 to 2 times the cost of a standard kit. So you do have this additional cost which the surgery will have to incur in order to get onto guided, but also there's the learning curve and there's that whole trust factor in that, is it as good as everyone says it is? So in my opinion, that's not the best reason in the world, because you can borrow kits from companies, and if you think that it is as good as it is, then it's almost a no-brainer to buy a surgical kit. Now, I don't use this, and being as amazing as it is, I don't use it for all cases. Typically, I will not use it for all-on-4 cases, and I don't use it for any case where we're basically replacing a full set of teeth on dental implants, so implant dentures and things like that. The reason is, number one, for really good accuracy, you do need teeth there. You need solid teeth. So if your guide is sitting on the gum, it's a completely different ball game. There are techniques and things to make that more accurate, but another reason is, for all-on-4, you don't need to be as pinpoint accurate as you do with a single tooth implant. With all-on-4, there are a couple of guidelines that you use, and I do use guides, but not as accurate as the ones that I'm describing here for that. There are systems available for fully guided surgery for all-on-4, but to be honest, I would only consider using those in very complex all-on-4 cases. And to be honest, they don't come around that often. So I hope this video has helped to explain what guided surgery is, why it's worth it, and when it is worth it. If you've got any questions or comments, you can always leave them below. I will try and get back to anyone. And if you've got any questions, if you're thinking about having dental implant treatment, you've got questions, things like that, put them below, and it might help inspire me for my next video. Okay, until then, take care.